Good afternoon, everyone, and thanks so much for joining us for 12 News at 4. I'm Tram Mai. We start with a mysterious illness spreading in dogs all across the country. So far, Arizona State veterinarian reported 2 confirmed cases. Both dogs had recently been to Oregon, which is seeing the worst of this outbreak. The Arizona Humane Society says the illness is spreading through close contact with other dogs. Cases have been reported in at least 14 other states. From Washington to Florida, the most high-risk groups are puppies, senior dogs, and dogs that already have health issues. The usual antibiotics for dogs typically don't work with this illness, which is really causing a lot of concern for many dog owners. So right now, we want to bring in our expert, Dr. Brett Cordes from Arizona Animal Hospital. Brett, I gotta say, as a dog owner and just talking to the people in my circle who are also dog owners, this is really scary.
Scary indeed, but I spent this morning talking to 2 state veterinarians, our own state veterinarian here in Arizona, and Dr. Greg Needle from Rhode Island, who for the last year has been familiar with this mystery outbreak. And he's been doing the metagenomics, meaning the DNA sequencing to look for what organism could be causing this. And the good news about all of this is that they all have reported back to me, and my message is, the message that they've given to me is that this is a code yellow right now, not a code red.
Okay.
That, not to hit the panic button,
Right.
but what are we as pet owners, or what are we doing and thinking about coming up with the holidays? Many of us have travel plans.
Yeah.
We've booked our pet resort months in advance.
Right.
Those kinds of things. So my advice there, after listening to these guys, these experts, is the high risk category. That's going to be your young puppies that don't have all their vaccinations under 6 months of age. It's going to be your older dogs with some conditions, health conditions, maybe a compromised immune system. And then the third are those our cute little Frenchies, you know, and the boxers and those breeds that we call brachycephalic.
Yeah.
Their airways can be compromised, and these respiratory diseases actually hit them harder. So dogs like that, we might want to keep out of high-risk situations.
Okay.
Dog shows, dog parks, kennels, and resorts. Probably the most important thing as we are starting to sift through and really understand what this is would be to vaccinate for kennel cough. That protects against 2 of the dozen respiratory diseases that we know. And 2, go see the vet if you have a cough that persists.
Okay.
My opinion is the treatment with antibiotics and a little anti-inflammatory has probably treated most of these dogs.
Okay.
We haven't done a good enough job with biosurveillance, really, most of the time dogs come in with coughing, we treat the disease and it gets better.
Okay.
The ones that don't, we need to do a better job with testing and treatment.
Okay.